Nearly 80% of women over 50 notice dryness, irritation, or thinning skin down there. But this isn't about hygiene or aging poorly, it's about skin health. The intimate skin has its own structure, circulation, and pH balance, just like the skin on your face, and it also ages over time. As a gynecologist with over 15 years of experience in women's dermatologic and hormonal care, I've seen how these quiet skin changes affect not just comfort but confidence and daily life. When estrogen levels drop, the skin's collagen and lipid layers weaken. The barrier that once locked in moisture starts to break down, leading to dryness, burning, or even micro tears from friction. But the good news is these changes are dermatologic, not irreversible. With proper care, hydration, and evidence-based skin treatments, we can restore thickness, elasticity, and comfort safely. Today, I'll walk you through what happens beneath the surface and how to keep your intimate skin healthy, hydrated, and resilient after 50. If you've ever experienced irritation or dryness and thought, maybe it's just my age type 1 in the comments, you're not alone and it's completely treatable. And before we begin, please subscribe to my channel and help me reach my first 10,000 subscribers. Your support helps me continue sharing real science-based guidance on women's skin and health every week. 1. Understanding intimate skin structure and function. The skin in the vulvar area may look delicate, but medically, it's one of the most complex types of skin on the human body. Unlike the skin on your arms or face, it has a thinner outer layer, higher moisture content, and a dense network of sensory nerves and small blood vessels. This design keeps the area flexible, responsive, and well protected as long as its natural balance remains intact. The outermost layer, known as the epidermis, works as a barrier that shields against bacteria, friction, and moisture loss. Just beneath it, the dermis contains collagen and elastin, two structural proteins that give the skin firmness and elasticity. Within this layer are sebaceous glands and tiny capillaries that deliver oxygen and nutrients. Together, these elements maintain a healthy skin barrier that resists irritation and retains hydration. However, intimate skin also operates within a narrow biological balance. Its natural pH is slightly acidic, usually between 4.0 and 5.0 to discourage harmful bacteria and maintain a stable microbiome. When this balance shifts, whether from hormonal change, harsh cleansers, or friction, the skin becomes more permeable and prone to inflammation. That's why dermatologists and gynecologists both emphasize protecting the skin barrier as the foundation of care. It's also important to recognize that the vulvar region is partly mucocutaneous, meaning it transitions between mucous membrane and regular skin. This makes it more sensitive to dryness, soap residues, and temperature changes. As women age, and especially after menopause, this hybrid structure becomes thinner, less elastic, and more fragile, which explains the frequent irritation many experience. Over time, even mild external stressors like tight clothing or scented hygiene products can accelerate damage to the protective layer and compromise the skin's natural resilience. Understanding this anatomy is the first step in addressing changes correctly. When we know how the intimate skin is built and what keeps it healthy, we can move from guessing to precise science-based care. In the next part, we'll explore how aging and hormonal shifts subtly alter these layers, setting the stage for many of the symptoms women begin to notice after 50. 2. How aging affects the skin barrier. As women age, one of the most significant yet overlooked changes happens within the skin barrier itself. This barrier, the thin protective outermost layer of the vulvar skin, functions like a shield. It locks in natural moisture, maintains elasticity, and keeps irritants out. But starting in the late 40s and 50s, a gradual biological shift begins. The production of collagen, elastin, and lipids declines, while the skin's ability to hold water decreases. These changes are subtle at first, but compound over time, leaving the skin thinner, drier, and more vulnerable to irritation. Estrogen plays an indirect but vital role in this process. It helps regulate collagen synthesis and the distribution of natural oils that keep the vulvar skin supple. When estrogen levels drop during menopause, the skin barrier loses some of its integrity. The lipid layer, which acts as the sealant, preventing water loss, becomes patchy. As a result, the surface can feel rough or tight, and microfissures, tiny cracks invisible to the eye, may form, leading to stinging or burning sensations. Another key factor is circulation. Aging reduces microvascular blood flow, meaning less oxygen and fewer nutrients reach the skin cells. This limits their ability to repair daily wear and tear. The dermis also loses thickness, and the connective tissue supporting it begins to weaken, further reducing the skin's resilience. Combined with lower collagen turnover, these structural changes explain why friction from walking, clothing, or sexual activity can become uncomfortable for many women. At a biochemical level, the balance of the skin's pH and microbiome also changes. The pH rises slightly, allowing harmful bacteria and yeast to thrive more easily. The friendly lactobacillus population that maintains natural acidity decreases, which can lead to chronic irritation or inflammation if not addressed. This is why many women notice persistent itching or redness even without infection. The barrier is simply compromised. Understanding these mechanisms clarifies why aging skin in this area needs specialized dermatologic care. Restoring barrier strength isn't just about applying moisturizer, it's about rebuilding structure, supporting collagen, and maintaining the skin's natural defense system. In the next section, we'll look at the visible signs that reveal when your intimate skin barrier is beginning to weaken and what those signs actually mean. 3. Visible signs of intimate skin aging. The signs of skin aging in the intimate area are often gradual, which is why many women dismiss them as normal until discomfort becomes unavoidable. The first and most common change is dryness. The skin begins to lose its soft, hydrated feel and instead becomes papery or rough to the touch. This happens because the upper epidermal cells, which normally trap water, begin to flatten and separate. Without adequate lipids and collagen beneath the surface, becomes dull and fragile, unable to retain moisture for long. Another visible sign is thinning and discoloration. The skin may appear lighter or more translucent due to reduced blood circulation and collagen loss. Some areas, particularly along the outer folds, may darken slightly as melanin production becomes uneven. This variation in tone is harmless, but it can make the area look older or more sensitive than before. Women often describe it as the skin just doesn't look or feel the same anymore. The loss of elasticity is another hallmark. As the connective fibers within the dermis weaken, the skin may sag or feel looser. This doesn't affect function, but it can cause discomfort from friction when walking, sitting, or wearing tight clothing. The tissue can also become more prone to tiny fissures, small tears that may sting or burn, especially after cleansing or during physical activity. In more advanced stages, women may notice increased sensitivity to products or temperature changes. A mild soap or detergent that once felt fine may suddenly cause itching or redness. The underlying cause isn't allergy, but a weakened barrier that can no longer regulate exposure to external irritants. Sometimes persistent irritation can trigger a low-grade inflammatory cycle causing ongoing redness or soreness that lasts for weeks. These visible and sensory changes are not purely cosmetic. They are dermatologic indicators that the skin's structural integrity is declining. Recognizing them early allows intervention before discomfort becomes chronic. Up next, we'll discuss common skin conditions that can develop as this barrier weakens and how to tell the difference between normal aging and medical skin concerns that require professional care. 4. Common skin concerns beyond dryness and irritation. Once the protective barrier begins to weaken, the intimate skin becomes more reactive. And this is where dermatologic conditions can quietly emerge. What many women assume is just dryness is often a combination of barrier damage and inflammation beneath the surface. When the skin is thin and dehydrated, it's no longer able to defend itself against everyday irritants like detergents, fabric dyes, or even pH imbalance from cleansing products. One of the most frequent dermatologic issues in women over 50 is contact dermatitis. This occurs when the skin reacts to soaps, wipes-scented panty liners, or certain fabrics. The symptoms can mimic an infection, redness, burning, or mild swelling, but they are caused by irritation, not bacteria. Another common condition is lichen sclerosis, a chronic inflammatory disorder that makes the skin white, shiny, and fragile. Though benign, it can cause severe itching or pain if untreated, and it requires medical supervision to prevent complications. Eczema and fungal irritation are also more likely as the pH and microbiome shift. When the natural acidity decreases, yeast, such as Candida, can multiply more easily, leading to mild but persistent itching. It's important not to self-diagnose or rely solely on over-the-counter creams. These can temporarily mask symptoms while worsening the barrier damage underneath. The best way to protect yourself is to adopt a gentle care routine and monitor any recurring changes. If irritation lasts more than a few days or returns after treatment, it's time to consult a dermatologist or gynecologist who specializes in vulvar skin. A simple examination can often distinguish between irritation, allergic reactions, and true dermatologic disease, saving you weeks or even months of discomfort. If you've ever struggled with irritation that seemed to appear out of nowhere, share your experience in the comments below. You might be surprised how many women have gone through the same frustration. Your comment could help another woman realize that what she's feeling isn't just her, but a common treatable skin concern. Open conversations like these help more women recognize their symptoms earlier, and that awareness can make all the difference. 5. Everyday care routine, cleansing and moisturizing the right way. Dermatologic care for the intimate area begins with something simple but crucial: how you cleanse and protect the skin every day. Many women unknowingly disrupt their natural barrier by overwashing, using antibacterial soaps, or relying on fragrance products that strip away protective oils. The goal isn't to clean more, it's to preserve balance. The vulvar skin is self-regulating and does not need aggressive cleansing. What it needs is gentle, consistent maintenance that respects its microbiome and pH. When choosing a cleanser, look for one labeled pH balanced around 4.0 to 5.0 and fragrance-free. Mild dermatologically tested cleansers with ingredients like cocamidopropylbutane or glycerin help lift impurities without removing essential lipids. Avoid antiseptics, alcohol-based wipes, or products labeled antibacterial. These can trigger microinflammation that damages the barrier over time. During washing, use warm water and your hand, not a washcloth or sponge, which may cause friction. Afterward, gently pat the skin dry with a clean, soft towel rather than rubbing. Moisturizing is the next essential step. Just as facial skin benefits from regular hydration, intimate skin thrives when moisture is restored to its deeper layers. A vulvar moisturizer, not a lotion or cosmetic cream, should be applied 2 to 3 times a week. Choose formulations containing hyaluronic acid ceramides or squalane to support the barrier and attract water into the skin. These ingredients help repair micro tears and maintain elasticity, reducing the feeling of tightness or stinging. For those with recurring dryness, using a thin layer of protective ointment before long walks or exercise can prevent friction and irritation. Think of this step as shielding your skin, much like a lip balm protects chapped lips. This doesn't interfere with natural processes, it simply adds a layer of comfort and resilience. Caring for intimate skin isn't about achieving perfection. It's about maintaining health and comfort as your body evolves. When you adopt a simple, gentle, and consistent routine, you create the foundation for lasting skin integrity. In the next section, we'll look at how dermatologic treatments can support this routine when home care alone isn't enough to fully restore balance and hydration. 6. Dermatologic treatments when home care isn't enough. Sometimes, even with careful cleansing and regular moisturization, the skin may still feel fragile or uncomfortable. This doesn't mean you've done something wrong, it simply indicates that the underlying barrier needs more advanced medical support. Dermatologic treatments can help rebuild structure, restore hydration, and improve the skin's ability to protect itself. These treatments are designed to target the biological changes within the tissue rather than just masking surface symptoms. The most effective and well-researched option is topical estrogen therapy, prescribed in very low doses. Unlike systemic hormone therapy, topical estrogen works locally to thicken the epidermis, stimulate collagen production, and increase natural moisture retention. This improves skin tone resilience and comfort often within weeks. It can be applied as a cream tablet or small vaginal ring depending on what your doctor recommends. For women who cannot use estrogen, there are equally safe non-hormonal alternatives containing hyaluronic acid, DHEA, or ceramide-based compounds that focus on rehydrating and rebuilding the skin barrier. Beyond medical creams, dermatologic technology has advanced significantly. Treatments like fractional CO2 laser or radiofrequency therapy can stimulate new collagen and improve blood flow to the area. These procedures use controlled energy to encourage the skin's natural healing response without causing injury. Over time, this helps restore elasticity and reduces the sensitivity that often comes with thinning skin. In some cases, dermatologists may recommend prescription barrier repair creams containing urea glycerin or niacinamide to support long-term hydration. These formulations are specifically designed for fragile or postmenopausal skin and help restore the lipid matrix that keeps moisture sealed in. Whatever treatment path you choose, professional guidance is essential. Each woman's skin responds differently depending on her hormonal history, medical background, and lifestyle. Consulting a gynecologist or dermatologist trained in vulvar skin care ensures that your treatment plan is both safe and effective. Medical intervention is not a sign of failure. It's a proactive step toward restoring your comfort and confidence. Once the barrier has been rebuilt, the skin often becomes stronger than before, proving that aging changes are manageable with the right dermatologic care. In the final part, we'll explore how to preserve these improvements through simple, sustainable habits that protect your skin for years to come. 7. Prevention and long-term maintenance, protecting intimate skin health. Once the skin barrier has been restored, the next step is preservation. Aging skin doesn't stop changing, but with consistent maintenance, you can slow its progression and keep discomfort from returning. Prevention is not about doing more, it's about doing the right things consistently. The intimate skin thrives on stability, and even small daily choices can protect its structure and function for the long term. Start with hydration and circulation. Drinking enough water and engaging in light physical activity, like walking, yoga, or gentle stretching, improves blood flow to the skin and supports oxygen delivery to the tissue. Better circulation means healthier cells and faster recovery from friction or minor irritation. Avoid prolonged sitting when possible and choose breathable cotton underwear that allows airflow and minimizes heat buildup. Nutrition also matters more than most people realize. Diets rich in omega-3 fatty acids, vitamin E, and antioxidants strengthen the lipid barrier from within. Foods like salmon walnuts, flaxseed, and avocados provide essential fatty acids that keep skin supple and reduce inflammation. Similarly, leafy greens and citrus fruits support collagen synthesis through vitamin C, a vital cofactor in skin repair. Maintaining a balanced microbiome is another essential aspect of prevention. Avoid using antiseptics, perfumed wipes, or douches as they can strip away beneficial bacteria and disrupt natural acidity. Instead, opt for gentle cleansers with mild surfactants and moisturizers that mimic the skin's natural lipids. If you experience occasional dryness, reapply a thin layer of vulvar moisturizer after bathing or before bed to keep hydration steady. Finally, make self-examination a part of your monthly routine. Use a handheld mirror to observe your skin's color texture and any new changes. Early detection of irritation or lesions can prevent more serious issues from developing. It's also important to have an annual checkup with your gynecologist or dermatologist, even if you have no symptoms, to ensure the skin remains strong and healthy. Your skin will continue to change as you age, but those changes don't have to mean discomfort or loss of confidence. With steady attention and dermatologic care, you can maintain the same softness, resilience, and comfort that define healthy, vibrant skin at any age. Caring for intimate skin after 50 doesn't have to be complicated. What matters most is consistency, small, steady actions that allow the skin barrier to rebuild and maintain hydration. When you create space for your skin to recover, it can regain its softness and comfort naturally. This 4-week plan is designed to help you gradually restore balance and resilience without overwhelming your daily routine. During the first week, focus on simplifying and protecting. Remove any harsh cleansers, scented soaps, or antibacterial wipes from your bathroom shelf. Switch to a pH-balanced, fragrance-free cleanser designed for sensitive skin. Wash gently with warm water using only your hand and pat dry with a soft towel instead of rubbing. Wear breathable cotton underwear and avoid synthetic fabrics that hold moisture and heat. These small changes calm irritation and give your skin a chance to reset. In the second week, begin rehydrating and repairing. Introduce a vulvar moisturizer 2 or 3 times a week, ideally one made with hyaluronic acid or ceramides. Apply a small amount after bathing or before bedtime to restore the lipid barrier and lock in moisture. If you often feel tightness or friction when walking or sitting, apply a thin protective ointment to reduce chafing and support the healing process. By the 3rd week, it's time to support and strengthen. If dryness or sensitivity continues, talk to your doctor about a low-dose topical estrogen or a non-hormonal repair cream. Start adding light physical activity or simple pelvic circulation exercises into your day. They improve oxygen flow and help the skin renew faster. Combine this with meals rich in omega-3s, vitamin E, and antioxidants to nourish skin cells from the inside out. In the 4th week, focus on maintenance and awareness. Continue your gentle care routine and pay attention to how your skin looks and feels. Most women begin to notice smoother texture, less sensitivity, and easier hydration at this stage. Make moisturizing and gentle cleansing part of your long-term routine, not just a short treatment. With steady care, the skin stays balanced, resilient, and comfortable, proof that restoring intimate skin health is not only possible, but entirely within your reach. Your skin's changes after 50 are not signs of weakness. They're simply your body's way of adapting to a new hormonal rhythm. With the right care, hydration, and attention, that delicate skin can become strong, supple, and comfortable again. What matters most is not perfection, but awareness. Understanding what your body is telling you and responding with patience and consistency. Never ignore persistent irritation, burning, or changes in skin color. These are not just part of aging, but signals that your skin needs support. A gynecologist or dermatologist trained in vulvar health can help you find safe, effective treatments tailored to your body. And remember, small daily habits, gentle cleansing, moisturization, balanced nutrition, and movement are far more powerful than any single product or quick fix. If today's discussion helped you understand your skin a little better, please leave a comment below and share your experience. Your story may be the reminder another woman needs to take her comfort seriously. Thank you for watching and for being part of this growing community. Don't forget to subscribe for more evidence-based guidance on women's health and self-care. You are not too late. This is where healing begins.